910 Big 550 KTRS. It has become a instant tradition here around the Big 550 KTRS. It's the board meeting, and we are officially in session. Former Chief of Staff to Governor Holden, Jane Dueker. Jane, good morning.
Good morning, McGraw.
House Majority Leader John Diehl, also Speaker in waiting, John Diehl. John, good morning.
Hey, good morning, McGraw.
Tony Messenger called in a late scratch. We tried to tell him that the good ones play hurt, but Tony Messenger not able to answer the call this morning.
Sick.
So, he's sick, all right.
Yeah,
That's
well,
exactly
Sick
right.
and twisted.
We're just trying to figure out what kind. But...
Sick and twisted, and on top of that, he doesn't feel well.
Right.
So, Tony Messenger, editorial page editor of the St. Louis Post-Dispatch, listening at home,
Yes.
Unable to call in, so we could drive him crazy.
That's right.
Today. Let's get right to it. Jane Dueker, your beloved St. Louis County cannot get out of their own way. What's the latest with our St. Louis County?
Well, there seems to be another FBI investigation going on, and this time we have the second in command at the Department of Health, who is, I guess, the executive. I don't know. That was the position created, but he's second in command. Has set up a company and was invoicing the county and for his own computer company, and latest numbers seem to be over $1.5 million over a 5-year period. And
he happened to have a $1.5 million house.
And he made $89,000. I think he was when he filed for bankruptcy in 2004, and because he made $500 a month as a laborer, and then got a job in the county, and things started turning up. And by 2008, 2009, he had a $1.5 million house, and all was well.
Hey, the guy pulled himself up by the bootstraps. Come on now.
He sure did. And then I guess somebody started figuring out what was going on, and unfortunately, he took his own life. And so in the last few days, we heard from the director of the Department of Health, who indicated that the contract involved was not let out at the department, but was in fact let out by Central Procurement in St. Louis County. And to me, that's the disturbing part, is that, please tell me that there's someone in the county who goes through all these contracts and says, oh, this is an actual company, and that this company exists, and that this company, actually performs services before you let out a contract. I mean, this was 5 years. And so, if there's not practices in place that would make sure of the very basics, I can't imagine how we don't have other issues involving contracts. And we do. I mean, we know we had an issue with, the police board, same problem. Somebody who shouldn't have been getting a contract with the county got one. I mean, who's not vetting this? So at worst, you have incompetence. I mean, at best, you have incompetence. At worst, you have something, far worse.
Well, this is clearly a pattern. It goes,
Absolutely.
I mean, this is, you mentioned, too, you also have Kathy Burkett, who's a sitting council person, gets a fee office.
Right.
This is now 3, and I'm sure we're forgetting some others.
Absolutely.
But there's clearly a pattern here of total mismanagement going on in St. Louis County.
At best. I mean, I think there have been times, I guess we'll find out about the police board contract, because the FBI has that one as well.
How much of this is Charlie Dooley's fault?
Oh, I unlike maybe some executives, I think that the executive is responsible for his agencies. So when I hear the county executives say, I don't do contracting, well, yes, you do. You're in charge. You're the boss. It's your name on the door. So you're responsible. Buck stops with you. I mean, this is Harry Truman's state.
If you can hire or fire the guy who makes the bad decision, that decision rests with you.
Exactly.
But I think it's also symbolic of a bigger problem that we have, and that is the attitude, I think, of a lot of people in government that somehow this money is theirs, and this attitude of free money that's floating out there. When you don't have a stake in how this money is being spent, you're a lot more careless and cavalier with what's going on. What you've seen, particularly in a lot of counties and cities across the state and across the country, is all this infusion of the stimulus money since 2009. Where you have all this free money and all this money that comes in that no one really has a plan for, but you have to spend it or it's gone. And after we saw this topic, I went and pulled the budget from this particular department. Mm-hmm. And in 2009, the actual expenditures for this department, this is under executive administration where there's 19 employees, okay, went from $4.9 million to this year. See how bad my eyes are.
Yeah, no, it's basically doubled.
$10.2 million.
I mean, I
For
look at
19
that. Now they
employees.
built in their defense, they did build a building, a new Department of Health.
And that's
they-
what we need is more government buildings.
And I don't know yet if that was an appropriate expense. And they did double the amount of employees. I don't know why.
Right.
And that
What
is
about
something.
the heating and cooling contract?
Well, you got to wonder now. Is that Samsung?
I mean, you really have to question every single contract that the county gives out.
Right. I mean, I don't know about stimulus money. Whatever money comes into the county, you should have a process in place to make sure that money does have a plan. And that money. So I don't blame it on the money. I blame it on the administration. These people committed crimes. I mean, the FBI's looking at this stuff.
But they're viewing it as free money.
I
So
guess.
the standards on how you spend that money, I think, are a lot less than how it used to be. And you go down, there's performance measures for this department. Okay, and one of them is food establishment inspections. Well, that's actually gone down, even though the money's
the actual health part.
doubled.
Right.
Okay?
The health part.
The actual health part, right?
The little more about the same on communicable disease.
Right, that's,
Tracking
again,
down,
health.
the part. They did collect about another 30,000 tons of recyclables, but that's a pretty expensive $5 or $6 million.
But
for old soda
the
cans.
overall question on this is, how does somebody go 5 years?
Oh, it's unbelievable. to me.
And no one noticed he's driving a Lamborghini
Right.
On a $90,000 salary, building
Right.
a $1.5 million house. The guy wasn't even smart about stealing money.
He probably
No,
didn't have the
wasn't-
department Christmas parties at his house,
Right.
probably.
I mean, and then you have a department director getting up there and saying, don't worry, residents of St. Louis County, your money's safe here. And I was appalled that there's no remorse. It's just not my fault. Well, yeah, it is, because somebody has to be responsible for the county taxpayer money. And when you run for that office, it's you. And, so I am not only concerned about the crimes that are going on, but the fact that no one is really that upset about it and really wanting to do anything about it.
That's my point. That's what I find fascinating. The lack of outrage
Right.
is worse, I think, than the guy stealing the $1.5 million.
Oh, I mean, I don't understand how it's possible that there is a politician anywhere that
That's
could
not
be
outraged by it.
embroiled in at least 2 or 3 FBI investigations, and people aren't, storming the building saying, "Get out." It really is amazing to me.
Where are all the other elected officials?
I
mean, Mayor
Well, I
Slay's
think-
holding fundraisers for Charlie Diehl.
Well, that's another issue. I mean, in the county council, I mean, they're doing their best. I mean, they're getting up and saying, we want background checks on appointees, because every time you turn around, there's an appointee that has either fleeced the county or has tax problems, and so they try to put up barriers. But the bottom line is this is the executive branch's problem, and so it is amazing to me that there's a politician out there that's this embroiled and people aren't going
More
crazy.
outraged by it.
Yeah.
And I still submit too, and I know kind of beating a dead horse on the stuff, but it also has to do with all these little honeypots of funds and monies out there that aren't transparent to the public. Here's another one I just pulled up. It just happened to be on the page before the health services. So when I printed this up, the Children's Services Fund went from $64,000, in 2009 to $36 million.
Well, that's
today.
a,
Now, I know
that's
there's a sales
dedicated, that's a
tax. No
dedicated
doubt about
tax.
it.
Now, but it's embroiled in its own problems.
Right.
Don't even get me started on the Children's Trust Fund.
Well, actually,
because-
no. This is an important point. This is the one Tony Messenger said, that they don't even have a quorum because they
Right.
can't find people
Right.
to sit on the board.
Yet
Right,
they're
or
spending
come to meetings.
$36 million.
Oh, and it's more than that. And that
More.
money sat there for 2 years before they got it together to get the standards together. And now they're having trouble with, they're trying to standardize rates and, and the people who are frankly involved have no idea how to do this stuff. I mean, it's right. You follow the money, you follow the contracts, and there's problems in the county.
Yeah.
And it is a pattern.
And then this is a problem throughout government. You see at the state level, too, you have all these little funds that have been set up.
But nobody
over
gets
the
away
course
with
of
this.
time.
I don't know another
I don't.
politician that I've ever heard of in my entire
Gets away
career
with
that has
this.
gotten away with the number of problems that we've seen in St. Louis County.
But when you
it's that
have
simple.
quote-unquote free money laying around, it's going to be a temptation.
Well,
for
not
people
everybody
to do
abuses
stuff.
that.
Well, you have free money, but how about the fact that, man, maybe it is because Charlie Diehl is so insulated. I mean, there's no real competition. The Republican
Not
Party
yet.
can't. There aren't enough support for Republicans in the county. Democrats can't beat him. I mean, this guy is got to be the most powerful politician in America. Nobody can get to him.
Well, I don't
nobody,
think
nobody
that's gonna
questions
last.
him.
Well, I don't think that's going to last. But I mean, I would think that at some level, and I've seen some interviews of County Executive Diehl on television, and he's like, everything's great. Labor's leaving me, and
But everything's great.
And even though this guy fleeced the county for 5 years, your money's safe with us. It's amazing to me that he can look in a camera and not admit something's fundamentally wrong.
That's Jane Dueker. She's former Chief of Staff to Governor Holden. Also with us is John Diehl, House Majority Leader. It's something doesn't sit right when the both of you agree on a topic.
Oh,
so
it's disturbing. I mean, do
we
you
will
feel the world spinning?
we will try and do better next segment. The 921 here at the Big 550 KTRS.
I wish you could get out of a primary.
925 Big 550 KTRS. Jane Dueker is the Chief of Staff for Governor Holden. She's now an attorney here in town. And John Diehl, House Majority Leader, Speaker in waiting. John Diehl. We'll get to both of them in just a second. The board meeting in session. Tony Messenger out, could not answer the bell. We're setting up our pitching rotation for the playoffs. So Tony Messenger is going to miss a start, so he's going to rest and sit on the sidelines for the playoffs. You can listen to us, KTRS. You can download the app from any smartphone. Listen to us anywhere in the world. And you can watch us on TV, KTRS.com, also STLtoday.com. John Diehl, you want to talk about the Affordable Health Care Act, which is coming to a flat screen near you soon, right?
Well, yeah, I think we're about ready to see a complete disaster start taking effect at the national level. I mean, this is what it looks like when you have the government try to take over 1/6 of the national economy. And, trying to simplify this a little bit, and we talk about this on the show quite a bit. I'm going to move my microphone over to the right side. Whether it's Ellisville or what we've just talked about, the county or the city-county merger, we always talk about how things in government need to be transparent. They need to be vetted out. They need to be done in the light of day. And this law has been none. Okay, these exchanges start going into effect on October 1st, and what we're seeing here is that the employer mandates now have been done away with. You're seeing certain groups like unions, Congress, government employees are all exempted from the mandates that every other individual is going to have in the state. You see 26 states that have adopted Medicaid expansion. You see 26 states that have not adopted Medicaid expansion, and what you're about to see is a lot less access to health care for able-bodied working people at a much higher cost. And there's a couple of government, games and language which is going on here. We're talking about subsidized. Well, what is subsidized coverage? Subsidized coverage is coverage which is paid for by the government. Okay, so it's a government price, not bringing down the cost of health care overall. It's just shifting who's going to have to pay for this. And the whole strategy right now appears to be of the Obama administration is they're going to make this thing work by getting able-bodied college students to sign up and actually pay for the long-term health insurance premiums that they don't pay for now. And that's just not going to work. You've seen the exchanges open in Tennessee, and their prices came out. It's 190% increase for young men. It's a 68% increase for young women on what they can get out there. There's just example of this, how this just isn't going to work because it wasn't properly vetted out in the light of day where people can work on it and have input into the process.
Jane Dueker.
Okay, first of all, let's first talk about exchanges, which is really ironic because actually before the name Obama was put on it, in 2007 and 2008, Governor Matt Blunt actually proposed using exchanges in Missouri. So to act like this is somehow some left-wing nut job idea is very silly. What exchanges do, and it's actually a consumer protection provision whereby private insurance companies get into these exchanges. They have to provide certain types of benefits, and you have to be able to compare apples to apples and oranges to oranges, because right now, if you go out on the open market and you try to get insurance, good luck in trying to figure out if you're getting ripped off, because you can't, really compare coverage because of the small print and the games that insurance companies play. And so this is a consumer protection device to make sure that all these companies, they get vetted, they have to have the same kind of benefits, they have to be transparent in what the proposals are and what the premiums are and what the coverage is, and then a consumer can go, instead of going out there on their own, because you can't afford to do that on your own because you're not a part of a big group and you can't get lower rates, then you have a clearinghouse that the state doesn't administer the insurance. All they do is administer the plan so that private insurance companies go in and agree to provide insurance at certain rates.
John Diehl, why is that a bad idea?
It's good for consumers. It's competition.
There's nothing more than
it's a Republican
apples.
idea.
I appreciate you say Republicans have ideas, but to say this was Matt Blunt's ideas.
Well, he proposed it in 2008.
He called it an exchange. The word is the same. There's nothing similar about it. No, in Missouri, the difference is you have the federal government coming in and sticking their hands. Matt Blunt's
because Missouri was stupid to say no.
Was a market.
That was our
place.
choice. Though,
that was our choice.
That was the state's
We could have
choice.
run our own
choice.
exchange.
It's the federal government's choice.
We opted out. We could have run our own exchange, and this state said no, and we criminalized it like a bunch of lunatics.
No, we would run the same exchange under the federal guidelines and laws. Okay, the result would have been the same. And what happens here is we have one exchange. So the Missouri exchange set up by the feds under Obamacare. I believe there's one insurance company that's going to be participating. And last I read over the weekend, we don't know yet because nothing's been released on it because it's all being done in secret. But from what you hear, BJC Network's going to be excluded. The St. Luke's Network's going to be excluded. I hear the Mercy Network is going to be excluded. So you're going to have one policy with very limited access for people.
But it doesn't prevent people from going out and getting their insurance.
The only thing similar about it is the word.
The only thing different about it is Republicans are telling people not to participate. That's the only difference between what it is now and what it was in 2008.
Why would I participate in that when I have worse coverage?
Well, you have coverage. There's a lot of people who don't have coverage. And there is nothing preventing people right now, under the mandate, from going to get insurance cheaper. You don't have to use the exchange.
What if someone doesn't want to have coverage?
Well, then, you know what?
Should they be fined by the federal government?
It is absolutely no different than you driving a car. You have to have insurance.
Hold on a second. I'm going to take this one. Okay.
Please, share.
Tee it up.
I agree with you. I totally, completely agree with you. Why does a healthy 20-year-old have to have insurance? You don't.
Correct.
But when the 20-year-old comes down with whatever disease,
they got to pay for it.
Don't come knocking on my door.
I agree.
But
we pay for it.
We pay for him when that person gets sick.
Then that's where the reform has to be.
Hey, I got no problem. You want to close the hospital door and say, I'm sorry.
Then admit it.
I'm sorry. You're not welcome here because you don't have insurance. I've got no problem with that. No one in the last 3 years talking about this has proposed that.
Correct.
But the scheme of saying that we're going to finance this, okay? I just think how silly this is, that we're going to finance this by getting those 25-year-old males to get out and pay for premiums. It's not going to work.
Nobody has the stomach
to say we're going to let people die in the emergency room.
Close the door of the hospital because you're sick.
Right.
No one's proposing that.
Because as a society, we don't believe that's accurate.
But if you do that, then you get rid of the hospital's charitable status.
I got no problem with that either.
I don't either. That's exactly right.
But
right now it's mandated.
You get rid of certificate of
need. The point is you can't. It's not a normal scenario. Yes, you're forcing people to buy their own health insurance.
Right. And when have we ever done that? When has the federal government ever forced people to do that?
No, the state government does it in car insurance. You are not allowed to drive without insurance. That's simple. We mandate it all the time.
Am I not allowed to breathe?
Well, right, but health care is not, first of all, it's ridiculous to say, okay, we're just going to, let everybody die. I mean, unless you want to admit
let's say I don't have a driver's license.
Right. That's fine.
Okay, I don't buy health. But, okay, in what circumstances do I not buy health insurance under this federal scheme?
Well, the circumstances...
that we pay for it. That's the difference.
We don't all pay for it.
If somebody gets sick, they go to the emergency room.
What if you don't?
Well, eventually, we
then
know
when you
for a
get
fact
sick,
someone's going to, you're always
Right.
going to get sick.
Right.
Everyone's going
That's
to get
why
sick.
you have insurance, is to
But
spread
what if I
risk.
pay for it on my own?
It's cheaper to the taxpayer to mandate
Oh,
insurance
wait, it's not.
than it is to cover them more expensively in the emergency room and without insurance.
If you
So-
want,
we
hold on a
already
minute.
know
If you
that.
want an opt-out clause that somebody signs the piece of paper and says you are refusing health care
Right.
and that when you get sick, you're
You're
on
out.
your own.
Why is
Great.
the
I got no problem
federal?
with that.
Why is the federal government
Because healthcare
involved in
costs are
this?
crippling this
Okay.
country and this economy.
Healthcare. So by putting
But
the
the
federal.
the federal
so-
government
so-
is
so-
forcing hospitals. The federal government is forcing
Forcing-
me, an insured person, to pay for people who don't have insurance.
And you have higher insurance rates
They're not
because of the uninsured.
forcing that.
well, but whoever
the market is the
taxpayer.
hospitals.
they're
get,
forcing the hospitals
the
to take it.
hospitals don't pay taxes because they have a charitable mission.
But we
But
pay-
when I
provide
buy a Big
care.
Mac,
Sure.
there's not 10 cents of that Big Mac is going to feed poor people who can't afford a Big Mac, right? Every time I go to the hospital.
When you buy a gallon of milk, okay,
yeah.
a portion of that sale price is paying for people who come in and shoplift.
Well, okay, but shoplifting is against the law.
Okay.
Right.
But sure. So the cost of delivering a good always it's part of what the market is. So if you buy something online at
There's-
you walk in
You would agree
any
with this.
account.
But my premiums go up because hospitals have to pay
your
uninsured
rates you
care.
charge your rates you're charged to your clients. And I do too. I'm an attorney. Also a component of that rate reflects people who don't pay their bills.
Right.
Okay? It's a receivable
Because
fact.
that's
Right.
good business.
Right.
And now
Because
you're
it's
saying
market.
not
But
good
again,
But
business.
the
the federal
federal
government-
government's not mandating.
But the federal government
different.
doesn't
Mandating-
force you
Right.
to
Take on clients.
take on clients.
That's the whole
And the
difference.
federal government shouldn't be forcing people to
Hey,
buy health insurance.
Change the law.
but you're
change the
forcing-
law. I'm with you on
right,
this.
but you can't have it both ways.
So I agree. Tort reform, sell insurance
Well,
policies
tort reform,
across
you don't
state.
even
and
tort
true
reform. Just
state-based.
tell hospitals that tell people if you don't have
state-based
insurance,
solutions.
You
if
don't
you
get
don't have
care.
insurance, you're on your own.
Right. And they can decide whether they take on the 20-year-old who gets in a motorcycle accident and is going to need thousands and thousands of dollars, hundreds of thousands of dollars of care.
I'm okay with
If
that.
this guy can't pay, we're turning him away.
Let's
and he's
roll.
gonna die
You get
in the
McCaskill
street.
on the phone. I'll get Blunt on the phone, and
Right.
we'll,
Yeah.
we'll get that
nobody,
proposed.
No one
nobody,
would do that.
nobody,
Because that's a disgusting society.
nobody would sign on to that.
Right.
Nobody would.
Right.
I'm an ogre because
Getting-
that's the way I believe.
Getting the federal government involved in how health care is delivered and putting another layer of bureaucracy, mandates, subsidies, and picking winners and losers is not going to bring down
So
the
if this was-
cost of
Stop that thought.
actual bringing
Okay.
health.
Stop that thought. That's John
I'm
Diehl,
back.
House Majority Leader. That's Jane Dueker. It's 66 degrees. The board meeting continues. John Diehl, who is no relation to John Beal, he's the House Majority Leader, Speaker in waiting. Also, Jane Dueker is with us. Tony Messenger is on the sidelines, called in sick. Jane, we're continuing the Affordable Care Act conversation because it dominates all conversations and so much information, misinformation, misunderstanding of it. What is the biggest misconception, or what do you want people to know about the Affordable Care Act and these exchanges that they don't know?
Well, this is the deal. Right now, if somebody goes to the emergency room or they get hurt and they're uninsured, by law, federal law, a hospital has to treat them. Okay? And so,
Signed by Ronald Reagan, I believe.
yes. And that's because as a society, we don't think people should die in emergency rooms, and I'm sort of in favor of that. And I think most people are. So now what you have is you have hospitals giving care, which means the insured population, the more uninsured people you have, the more in insurance premiums the insured population pays, okay, to cover the uncompensated care. So what people don't realize is the failure to cover people under either Medicaid or under a mandated insurance is that the insured population is paying for that. Your health insurance premiums go up. So that's the goal, is to try to stave that off, get that down by getting more people covered. And so Medicaid and insurance is a lot cheaper way to cover somebody's insurance than it is to let them go and just pay full boat. Because as you know, hospitals charge more for people who are uninsured. When you don't have a negotiated rate as part of insurance, then the people who don't have insurance or people who can pay get charged a lot differently. And that's another problem, is there's no transparency in costs of medical care. So once you get everybody insured one way or another, costs in general all go down because everything is negotiated, and the risk is spread among more people. Right now, the insured population is bearing all of the increased costs in healthcare. That should be spread out. And because everybody is politically afraid of a single payer system, like 46% of the population is already under vis-a-vis Social Security or Medicaid, Medicare, not Social Security. And by the way, those people and the veterans are very happy with their health care. But since people refuse to do that and have to have insurance companies, this is the model that was chosen in Massachusetts, which has gone very well. And so you spread the risk out and you get overall better care. And that is the whole theory behind it. It's not a crazy idea. It's a Heritage Foundation. It's a Republican idea in the beginning. They just don't like the federal government, and they don't like Obama.
You're saying it's the Heritage Foundation's idea to have a single-payer system ultimately in this country.
To have
that's
the system with private insurance still remaining in the game. That's where the dispute comes in. We want insurance companies to get their cut. Okay, fine. We want the private market to do this. So now these guys can compete, come into any exchange and say, okay, we're going to offer this, this, and this for this rate, and the consumer actually has half a chance to distinguish between what's going on. And so now we have a lot of people who don't want, are telling these guys don't do the exchanges. It's a crime if you talk about the ACA in Missouri, and we have all this cuckoo stuff going on in Missouri. But if you look at where it actually worked
a crime if
in Massachusetts, it worked. The consumer was better off. Healthcare premiums went down. The insured population stopped getting, bearing all the brunt. It did what it was supposed to do.
John Diehl.
It did. I mean, I've, all due respect to my good friend Jane, I've never heard a bunch of malarkey on this kind of stuff. I mean,
Massachusetts working,
this
right?
is intended to fail so we can get to a single payer system in this country.
Lord, the conspiracy of all
come on.
time.
Absolutely.
The Romney plan is a conspiracy.
Hey, come on, I didn't cut you in. First of all, there's a big difference between things being set up at the state level to run for state solutions versus a federal government coming in and mandating what every state and what every single person in this country is going to do vis-a-vis their health insurance choices. Okay, number one.
So you'd be okay with the ACA on a state level?
Number two, if that's what that state decided to do. That's the whole concept.
Personally, would you support this if it was done by the state instead of the federal government?
Who knows what's in this thing? I mean, if this is such a good deal, why pass the bill before people had a chance to read it?
You've had 4 years to read it. You still don't know?
It's passed.
Right. Did you read it?
And there have been problems with it since that time.
Well,
okay?
every program has problems.
You can't come in after the fact and say, well, you've had a chance to read it, but it's a law and we're going to implement it. Every day, or every quarter, there's tens of thousands of new pages of regulations which come out on this thing. We have exchanges going online that are saying this is the law, this is what it is, with no transparency. If it's such a good deal, why not pass it when everyone's had a chance to read it? Why not look at it and
Congress
get
has
input
had 4
from
years
everybody?
To make any changes to this bill that they've wanted. It was passed 4 years ago.
And what happens? It got passed through a reconciliation process. So
there are Republicans in Congress that could actually have a say in that. It's not like you act like this is passively passed over.
How many Republicans voted for this?
None.
Zero.
Of course they're not going to.
Zero.
But they don't want to make it
How
better.
Was it
they
passed?
just want to
How
say
did
no.
It get through
they want
the
to
U.S.
Ted Cruz
Senate?
it.
Through a reconciliation process. So let's go back through some of the fundamental points. First of all, getting the federal government involved in the health insurance industry is not going to bring down the cost of health care. You can't, there's no program that I'm aware of, okay, that the federal government has brought down the cost of anything on. Number two,
Medicaid. Medicaid is the first example of bringing down the cost of health care because having people insured, the CHIPS program is one of the best programs in this country.
It has not brought it down. It is not.
If we were paying for all, if the taxpayer was paying for all those uninsured kids,
how much?
Even Republicans will tell you CHIPS works.
And if this is intended to bring down the cost of those who have insurance, because those with insurance are subsidizing everybody else. Why is everybody who has health insurance, their premiums are going up astronomical sums across the country? And I know what Tony said last week. He said, well, actually the costs are lower than the costs are going down. Well, that's also a bunch of bull. The numbers
that's your
out there.
insurance company, buddy.
They are not. Well, you said this is going to bring down the cost of insurance.
No, that's what
it's
it
not.
should do.
It's not. Though.
Well, we have to
it's
implement
driving
it.
it up. Oh,
You
okay.
have to implement it.
So we're going to undo and destroy the best healthcare system in this country on a trust me, because some CBO or actuarials at the federal government have said that we're going to
So
lower
your
the cost of
position is
this over
doing
long
nothing
term.
is better.
That's
Yes.
That's John Diehl.
Absolutely.
Wow.
That's Jane Dueker. McGraw-Millhaven here. We'll
That's
come back for the
bad.
final moments. My final thought on this is I don't believe anybody. Here's what I'm tired of. I'm sick and tired of paying for everybody else's insurance, including mine. Elected officials, Ted Cruz,
Right. Sarah
bankers,
Palin.
Sarah Palin, Obama, homeless people,
Right.
people, 20-year-olds
Right.
who would rather spend their money on $400 pair of UGG boots and
Right.
$500 phones than actually pay for their own health insurance. I'm tired of paying for everybody else's insurance, and if one person is forced to buy their own health insurance, I'm for it.
Amen.
Back in a moment, Big 550, about lots of things. We'll finish with baseball, John Diehl, as the Cardinals get ready to wrap up the Central Division. What are your thoughts?
Well, I think we're in a golden age of Cardinal baseball, and
Agreed.
it's one of those things. I think people sit back and nitpick on this could be better, but look at it historically. 10 out of 13 years in the playoffs, 7 National League Championship Series. Look like they're heading back that way this year. So enjoy it, and I think it's actually going to get even better over the next couple of years.
I think so too. And what I love about Cardinal baseball and about being a St. Louisan is this. And St. Louis is at its best when Cardinal baseball is like this. And I was at the game yesterday, and it was packed. It was a day game. It was a sea of red against that beautiful green field. And these are the days, these are the times that you say being in St. Louis is heaven.
But there are still people who are still criticizing the DeWitts.
Absolutely.
Still criticizing Matheny.
uh-huh.
Doesn't know what. I mean, these people have no concept of what happiness is.
Oh,
Well, we're spoiled.
Right.
And if
it's
you think
just-
of what they've done with the budget, the market, the
Right.
TV market,
Right.
TV
Right.
revenue, and the young pitching they have,
Oh,
I
it's
mean,
wonderful.
They could be on a decade run like the Atlanta Braves for the 90s.
Life in baseball in St. Louis doesn't get any better than this. So
It's joy.
if you're not happy with the DeWitts or Matheny or Mo or whatever,
Right.
leave town because it's just
Right.
not going to get any better.
Right.
So there
I
you go.
scoff at you.
John Diehl, thanks for checking in.
Thank
Always
you.
a pleasure. Jane Dueker, former chief of staff to Governor Holden, thank you very much for coming in. Always a
Great to be
pleasure.
here.
You want to give a shout out to Tony Messenger?
Hey, Tony, freedom.
Get better. Get those prescriptions for your Sudafedrin.
Yeah, make sure you get that over-the-counter cold medicine so the meth heads can get it too. We are out. STLtoday.com, KTRS.com. We'll do it all again tomorrow. Have a great day, everybody. Be safe. Martin Kilcoyne's next. A tutto.